Okay, so welcome to part 2 of the Introduction to Dispensing lecture. So at the end of part 1, I gave a couple of items for you to have a go at. So thinking about how you would label that particular product, and also looking at what cautionary and advisory labels would be needed. So for the ibuprofen, you would have come up with something like this, hopefully. So 1 3 times a day when required. So the 1 and the 3 should be in capitals. And when you were looking out for the cautionary and advisory labels needed, you would need label 21, and that label 21 is for take with or just after food. So if you can't remember, then make sure you look in the BNF under monograph for the drug under medicinal forms. It tells you just under the name of the product, and it will vary on the dosage form, so you need to be careful on that you're looking at the correct warning label for the correct dosage form that you're using. Okay, so you've got the warning label there, and then the directions were take 1 tablet 3 times a day when required, and the 1 and the 3 should be in capitals as per gold standard labels. So the next one was trimethoprim. So this was a 3-day course. So you would have hopefully labeled it as take 1 tablet twice a day for 3 days. So again, the 1 and the 2 in capitals, and both of them in words. And the reason you don't put the number 3 in words is so it doesn't confuse the patient. Otherwise there's too many numbers there. So the number of days that the treatment is for should be in a number figure. Okay, so for 3 days, this one here. And then the advisory labels for this medication was number 9. So because it's an antibiotic, that's why the number 9 is very important. So they need to be spaced out evenly throughout the whole day, and also to finish the course as well. So to make sure that the infection gets treated and the patient doesn't stop too early, just because they start feeling a little bit better. So trimethoprim is an antibiotic, and nearly all, or actually all antibiotics will have this warning label. So hopefully you managed to get those 2 done. If there are any concerns or questions, then make sure you ask in the workshop later on this week. So now we are going to move on to selecting your products and the things to think about. So hopefully no one's pharmacy looks this messy, because it would be a nightmare to try and work in one of these pharmacies. Okay, so now if we imagine we need to dispense paracetamol tablets. So if we have a box of 100 tablets and they're paracetamol 500 milligrams, okay? So we need to make sure we have the correct medicine. And it's really important that you check inside the box. So when people are dispensing, some things might get transposed, and blisters might go missing. So it's always important that you check inside. So we know, for example, in our sort of pharmacy practice lab, sometimes the right thing isn't inside. Our students haven't put the right medication back inside the box. So you need to make sure that you do this for other students and for those after you. So making sure you put whatever you used in the correct box that you took it from when you have finished. Next thing you need to check is that if you've got the correct form. So is it liquid, is it soluble, tablets, or an injection, or suppositories? So in this case tablets. And making sure you have the correct strength, so 500 milligram, and then the correct quantity. So again, making sure you are looking inside the box, making sure you have a full packet, and then lastly checking the expiry date and making sure that this is in date. So obviously when you are looking at the expiry, you need to make sure it covers the full course of the treatment. So if you make a note now that in the pharmacy practice lab, you might see some products out of date. It's quite difficult for us to sort of keep up to date with each individual product. There shouldn't be many, but in case there are, then make sure you're highlighting that. But in actual pharmacies, it's really important that there are no out of dates on the shelf, and there's a strict procedure on date checking as well. Okay, so we've selected our product. In some cases you might have to pack it down, so then we will need to use a tablet carton. So we use some white tablet boxes if we need to provide a smaller supply to a patient from the original container. So normally white and cream, and you'll see these in our pharmacy practice lab, and they come in a variety of different sizes. So these days you don't have to often sort of pack down because most packs are done in calendar packs, and they're designed to provide enough medication for a month. So for example 28 tablets. So if you are using one of these tablet containers, make sure it's an appropriate size. You can fold the strip into the box, but you generally need to avoid cutting the strip, as sometimes information like batch number, expiry date can go missing if you start sort of cutting bits around. The boxes tend to be sort of less useful for a very small number of tablets. So let's say if you're just giving one tablet or a couple, then you would just pop this out and put it into a bottle, because otherwise there is a risk the patient might swallow the whole blister rather than taking out from the blister. So this has actually happened. I know it sounds unusual, but the foil people have swallowed, and then it's resulted in a hospital admission. So you can see from the picture you have a large flat sort of white side and then a narrower side. So when applying the label, make sure you try and put it on the larger flat side so it's easier to read. And if you are dispensing glass ampules, you would normally wrap them up in a tissue or something to stop them rattling around and potentially breaking. When you are packing down, you should also not use the original packet, so you should use a new box. And if you are working in pharmacies, then make sure you mark the original box with lines or crosses or some marking on the box, so the next person knows it's not a full box. Okay, so another common packaging that we might use is an amber plastic or amber glass bottle. We use the amber color because it helps protect the tablet from light, and so the capsule or tablet is less likely to be adversely affected by the light. So plastic is cheap and it less chance of breaking than glass, but sometimes we do need to use glass for certain drugs. Like GTN tablets, so glycerol trinitrate, we would put in a glass bottle, as they are better at keeping the air out, and so it keeps the moisture out. So glass bottles are better at keeping the air out. Okay, and some tablets with moisture can go all squishy. So for example GTN, the glycerol trinitrate tablets, are one of those tablets. That's because the tablet is hydroscopic. So that would need to go into a glass bottle, but ideally what we normally do is we keep it in its original bottle, and it has a special silver foil to protect the amount of air that can get into the bottle. Okay. So the bottles come in a variety of sizes, so make sure you're using a suitable size. We need to make sure the product is appropriate to be packed down. So for example, we wouldn't pack down stuff like Madapar or Nicorandil, as the original packet has a desiccant, and if you take that out, then those tablets then again can or may become affected by the moisture in the air. So we need to make sure bottles are suitable for use. So for example, there aren't any chips, making sure you're using the appropriate lid. So normally we will try and use a child resistant lid, so they're known as click locks, but sometimes these can be actually difficult for some patients. So for those with manual dexterity issues, so for example, if someone has rheumatoid arthritis, you may need to sort of consider using a wing top or like a plain lid, which is easier to open. So when you're putting the label on the bottle, you want to try and keep the instructions flat so it makes it easier for the patients to read. So try and put it flat on the face of the bottle. So if we have to pack down liquids, then we would put them into a liquid bottle. So again, usually made of amber glass. Most bottles nowadays are smooth, but you can get ribbed bottles as well as smooth. So we use the smooth bottles for internal liquids, and the ribbed bottles are used for external liquids. So it's ideal if you can get hold of ribbed bottles that you use them for external liquids, and that is just so if patients have impaired sight, they can tell from the feel of the bottle that liquid should be used externally rather than internally. So again, when you're using this type of bottle, you need to make sure it's the right size, there aren't any chips in the glass, and you're using an appropriate lid, and then you're putting the label on the curved side of the bottle, okay, and making sure it's straight obviously as well. So if we have to pack down loose tablets, then we might have to count them, so to make sure you have the right quantity. So you shouldn't do it with bare hands, and that's for both yourself and the patient. So sometimes we can use a counting aid, so like a tablet triangle. So that's the green triangle on the slide, or a capsule container, which is a metal device on the bottom of the slide, to the second picture. Or you can even use electronic counters, so for that you might need to use a spatula or forceps to handle the tablets so you don't touch them. So it'll be important for you to know your 7s and 28 time table. So probably or hopefully by the time you have qualified you'll be good with your 7 times table. And obviously it's important to avoid contamination, so make sure that the area and the tablet containers are kept clean. Okay, so when you are using your counting triangle, it counts in triangle numbers. So I've put this as an example, as a reminder here for you. So for example, if you had 2 rows of tablets, that would be 3 tablets. If you had 3 rows of tablets, that would be 6 tablets, and so on. Okay. So it's a much quicker way of counting when you have to do sort of like count large number of tablets. So hopefully some of you might have seen this in your pharmacies when you're doing your placements, or some of you are already working, which is really good. And if you aren't working, then a really good opportunity for you to go out and look at these things in your pharmacies. So when you are needing to measure liquids, then there are a couple of things you can use. So the first thing is a conical measure. So that's the one on the top right hand side. or you can use a cylinder, which is the one in the center on the bottom. You could also use the pipette if only adding like a small number of drops to something. And you have the option of syringes as well you can use. So for example, the purple syringe is used for oral use, so for patients to use orally. And obviously it's important that if you are using measuring equipment like this, then you know the difference where the meniscus should be. So if the liquid has a concave meniscus as shown in test tube A, then you would measure from the bottom of the meniscus. And if it has a convex meniscus, which is actually very unusual, I can only sort of think of one example, which is mercury in a thermometer, then you measure from the top. So for most medicines you will measure from the bottom as shown in image A, in those two test tubes at the top. Okay, so really important you know where to measure from. Okay, so obviously you then need to put in your product into the packaging, and then also making sure you have used the right sized package, and being careful sort of when you're pouring liquids or tablets into the bottle that they don't go all over the place. Okay. It's also really important that you include a patient information leaflet, which is often called PIL, so PIL. And this is a legal requirement actually. So every dispensed product should include the patient information leaflet. And so for your PAMS assessments at the end of the year, and even in later on in years, you will have a large deduction in your mark if you forget to include the information leaflet inside the box. So that is another reason to make sure you are looking inside, because again, students who have used those products before you are not always the best at putting things where they found them. So it's up to you to check the box when you're dispensing it, when you're using that box. Okay, so a brief bit about cytotoxic drugs. Okay, so you'll cover this in other areas as well, but you need to be able to understand a cytotoxic drug so you can dispense them appropriately. So normally these kind of medicines are used to treat cancer, but also certain other conditions. So probably the most commonly one cytotoxic that we normally see is called methotrexate, and that's commonly used for rheumatoid arthritis. So as well as being toxic to patients, they can also be toxic to you as well as the pharmacist or dispenser. So it's really important you handle them with extreme care, and that you don't touch them with bare hands. So you'll probably need to use specific counting equipment for these type of drugs. So the triangle and the capsule counter that we saw earlier, you would have separate ones for cytotoxic medication. They're kept separately, and you would use a forceps or spatula when counting, so you wouldn't touch them with your hands. And you should try and transfer them onto a counter as soon as you can, so they aren't just lying around on the counter. Okay, so transfer them into a container as soon as possible, and then make sure you clean whatever equipment you've used, so before and after, and discard of any waste carefully. Okay, and usually the pharmacy will have a specific cytotoxic bin that you'll be able to use. So for example, in this slide, the lid with the purple container is a special cytotoxic bin where only those drugs and the waste associated with those drugs go in. And a lot of pharmacies also often have cytotoxic stickers which you can stick to the medicines or the shelves as a reminder to the patient and to dispensers to make sure that you're handling that medication with care. Okay, so that was cytotoxic drugs. Okay, so now that we have dispensed the product, we need to attach the label. So when we're thinking about the label, it's important that we can read it first of all. And then when you're putting it onto the box, you need to make sure it's straight and not overhanging the edge. So I know it sounds sort of petty saying to put it straight, but it does make a difference to actually patients on how professional it looks. And also, if it is wonky, then it looks like you haven't really paid attention to what you're doing, and it sends the wrong message to the patient. And then the reason for not having the label overhanging is that there is a risk it could transfer to another product in the same bag, and I have seen that happen. So it's really important that you stick the label properly and it's flat and it's not hanging over the edges. So it's also important that you don't cover the key bits of information, so things like the name of the drug, the expiry date, or if there's any important storage information, so if like it's a fridge item, or any other warning information, like if the drug causes any drowsiness. Okay. Sometimes you might need to flag the label, so that if the packaging is quite small, like let's say for example eye drop bottles, a label won't fit on there, so you might need to flag the label, and I will show you this in the dispensing classes on how to do this. There's an art to do it, and it works really well. The other thing that is important to remember is that in our dispensing classes, that if you are dispensing where there might be an inner product, we need you to label both of these. So for example, if there's a tube like a cream inside the actual plastic box, you need to label both the tube and the box, and that's because the box will get thrown away by the patient, so it's only the tube that remains, so the label must stay on there as well. So you need to put it on both inside and outside if there's a product inside. Okay. Okay, so it's also important you check your work. So these boxes here, so the D is for dispensing and C is for checked. So unfortunately the system in the lab doesn't print these boxes that I've just shown you in the slide, but most pharmacies will have these pre-printed onto the labels. But we do want you to get into the habit, and we want you to add your initials, and so normally in the top right hand corner, make sure you've initialed it twice to show that you've dispensed and then checked that particular item. Okay, so get yourself into the habit of doing this. It also gives us an audit trail, so if there was an error that happens, you can go back to find out who prepared the product and who checked it. So make sure you do a final check, and as you move through the program through the 4 years, you're going to learn about how to conduct an accuracy check properly, but you do need to get into the habit of doing that final check before it goes into the bag yourself in first year as well. Okay, so once you have dispensed your item and you've produced the label, you'll need to endorse the prescription as well. So this is so you are paid correctly and that you've met any legal requirements. So the first thing to do will be to check in the drug tariff to make sure that you've endorsed with the pack size or any other information that you might need. And if you're unsure about how to do this, you need to go back and listen to the drug tariff lecture. Okay. So this one's really important. A lot of students tend to struggle for some reason, so please make sure you listen to the drug tariff lecture before coming into your session, because you will be expected to endorse the prescription as well. And then also making sure you put the pharmacy stamp. So this is the easiest thing you can do, and it's the easiest thing you can lose mark on. So putting the stamp onto the prescription. So this is a legal requirement, so it should have the name of the pharmacy and also the date of dispensing, which again is a legal requirement. So you need to make sure you've done this, otherwise this is the kind of thing that you lose more marks for, because it is a legal requirement. And also it shows that the date that you dispense the product, so it prevents it being dispensed again. So any potential opportunity for misusing drugs. Okay, so you're nearly getting there. So we are at the bagging up stage. So you bag your products. So you can get bags of different sizes, and it needs to look neat. And then you have an address label which goes over the bag to seal it. And remember any other information which might be needed. So some pharmacies use little stickers, like the ones on this slide. So these can be for an item that may need to be kept in a fridge, or if there's a controlled drug, then the pharmacist knows that there's a separate item, so you add a sticker to the label as well. And if it's a liquid, then it's also a good idea to include a spoon or a syringe, depending on what quantity the patient will be taking. So if it's 10 mils, you're probably not needing a syringe, whereas if it's 1 mil, then obviously a syringe should be needed. Okay. And then also check if you have if you need to give any other bits of information that might be needed. So some drugs which are at high risk have other extra information and booklets which are needed. So corticosteroids have a little booklet, and other drugs like methotrexate, lithium and warfarin also have booklets which need to be given to the patient. So the yellow book at the bottom on this slide is for warfarin, and make sure you provide these. So information about the drug, and also it might contain sort of monitoring information, so things like blood levels of the drug. So let's say if the patient becomes unwell, then the healthcare professional knows what the patient is taking and what dose they should be on. Okay, so include these with your high risk drugs. Okay, so once you've done all of that, then obviously you'll need to hand out to the patient. So at this stage you're thinking about what information the patient might need and what support they could do with. And we covered sort of some of this handing out points in your consultation sessions, which were at the end of last term. So as I said, you'll get a chance to practice this term on how to hand out and how to counsel, how to speak to patients. So a really good chance for you to practice this term. Okay, so that brings us to the end of the second part of this lecture. So overall, I think what we've covered is the whole dispensing process, and also how to handle cytotoxic drugs. We've looked at using sort of packaging, and in part 1 we spoke about the dispensing label versus the manufacturer's label. So you'll be coming up to your first PAMS class this week, and that's where we will introduce you to labeling, and then to dispensing, and then making sure we put this all together, where you will get an experience of screening the prescription, so what we did last term, dispensing and labeling, and putting it all together, all 3 of those steps as you come towards the assessment at the end of term. Okay, so I will leave it there. Hopefully you guys will have had a chance to watch both screencasts, and that will make things a lot easier before you come into your workshop. Brilliant. I will see you later on in the week. Excellent. Thank you guys.